Well, thank you, and it's a great pleasure to be here and to see such a lively crowd of hepatitis C researchers. Several of you I've met, several of you it's the first time that I meet, and it's a privilege and an honor. So today I'll present a little bit about Hep C research that is being funded through CIHR, and to give you a landscape and an opportunity of the different scenarios that one can see for funding. So if I go on the overview of the presentation, so we will discuss about the investment in HCV research, then about I think most of you are aware of a CIHR Joint Hepatitis C Research Initiative that I will discuss briefly, and I know that it has been discussed with some people yesterday to see how you're going to move forward on this. Then also, we'll discuss about some other priority-driven research that can be quite relevant to the hepatitis C research community. And then the investigator-initiated programs, which provide a substantial amount of funding for hepatitis C research in Canada. So this is the investment in hepatitis C research. I understand that this morning there was a similar graph presented by Curtis Cooper with different numbers. So there was, in your graph, there was some decrease. In our graph, it's fairly stable. So this is called responsiveness, yes. And basically, when I was discussing this with Jennifer Raven, I think you all know, I mean, there was a coding problem at CIHR, and so basically these are the real numbers. So it's in the current context, this is really great news. And the drop from 0506 to the rest is the when CANVAC was terminated. The funding is not equal in all streams. So as you know, at CIHR, there are 4 streams. One is biomedical, one is clinical, one is health systems, and one is the social, cultural, and environmental population health approaches. So as you can see, with the years, the level of funding in biomedical is slightly decreasing. The level in clinical research is fairly stable. I was quite surprised to see those numbers that in the health systems services, there is very little funding in 13-14. I think with the new network that is being prepared and discussed, possibly this level of funding will increase, but quite stable or slight increase in the Pillar 4 of CIHR. Also, as you know, at CIHR, about a little bit more than 50% of the budget is investigator-driven, so it's bottom-up. There are a number of tri-council programs, whether it's the Canada Research Share, whether it's the CERC, whether it's the National Centers of Excellence, and so on, that counts for another 20–25%. And there's 30 or a little less than 30% that are priority-driven. This is mostly institute budget, but there's also, we are 13 institute, but also other specific programs that we have, for instance, on animal care or things like that that are priority-driven. And as you can see, the level of funding in investigator-initiated research is fairly stable. For the Tri-Council, there's been fluctuation depending on whether the NCE were terminated or whether some people got the CERC awards. But this is the level of funding that is currently seen. So there's a specific program for hepatitis C research, and this was created or in response to the Criver inquiry. So initially it was with Health Canada because FAC was not existing at that time. And the first initial bilateral agreement was in 1999. So through ongoing commitment at the time with Health Canada, and now more recently, since 2004 with the Public Health Agency of Canada and CIHR, there's been a renewal of this commitment in 2004, 2006, 2008, and now I would like to acknowledge the great collaboration of the Public Health Agency of Canada to be able to reconduct this joint research, this hepatitis research initiative for 2014 until, well, it's going to be 15 to 2020. And this is to sustain the momentum Create Your Initiative. So it's a relatively small program, but as you will see, quite structuring. So this is, and I've asked Jennifer to calculate the overall budget, and it's about $18 million of this specific initiative that has been invested from 99 to 2014 in catalyst grants, 69 operating grants. So this is not it's a substantial amount of grant monies through a small program that were provided. I think you're all aware of the national training program that I think is one of the flagship of this initiative. And it was quite clear from the beginning with FAC and CIHR that in whatever format we would make things, there would still be a training program. Knowledge synthesis, planning dissemination, personal awards, so studentships, possibly, was there a new investigator awards? Yes, new investigator awards. And well, that must have been a very early in the program, a maintenance equipment grant, because I mean, those are important but rare at CIHR, and bridge funding. So, so this renewal, we had a number of discussions between FAC and CIHR and a number of stakeholders of how to move forward. I mean, it was a very successful program, and we say, can we try to do something that will even bring this to the further, a further level in terms of research? And at CIHR and FAC and on a number of different files, we did create networks, and I have to say that they're very, very efficient. One is on immunization. It's called the Canadian Immunization Research Network. We've done some on transplant, of solid organ transplantation. And really, it's really changing the way people are collaborating together to move forward for a better health of Canadians. So we've discussed about the opportunity of having a national hepatitis C collaborative network. And this is to support a cohesive collaborative research program in Canada that links researchers, but also the knowledge users, decision makers from all the 4 pillars: biomedical, clinical, health systems, and pop health. So it's to create strong linkages between researchers and knowledge users, decision makers, to facilitate and integrate knowledge translation approach. And I think this is it's so exciting time right now in the hepatitis C field to be able to perform some of those activities. And also to contribute to support training, so we discuss about the training aspect, and to improve the overall environment for hepatitis C research. So this network, and I know that you've been discussing about this, of how to move forward with this, will be at $850K a year for the next 5 years, and April 2005 is the application? Yeah?
Funding start date.
Funding start date. Oh, so the application is done. Okay, well, okay, and there's also another 50K that is available, and this is for meeting planning dissemination grants that people have benefited along the time. So what are the other possibilities? So this is Hep C priority. There's also a priority-driven research in the field of HIV that the budget is higher. It's $22.5 million a year. It is an A-based budget. It comes from the federal government. It goes to different agencies, and CIHR has an envelope of $22.5. And part of this federal initiative will address HIV/AIDS, of course, but also hepatitis C and other sexually transmitted infections. So there's a number of activities that are certainly relevant to the hepatitis C community. So the CTN, so CIHR Canadian HIV Trial Networks, where there are a lot of trials with co-infection. There's the centers that are more pillar 3 and 4 centers, like REACH, which is intervention, research, participation, evaluation, and applied program science in HIV/AIDS, but also Hep C and other sexually transmitted infections. And upcoming that we are in discussion with the Institute of Public and Population Health and the Institute of Aboriginal and Public Health about an implementation science in the field for prevention of HIV, HCV, and sexually transmitted infections. So about this program, so the future directions that one would like to apply, and this is also with the leadership of the Public Health Agency of Canada, an integrated approach for sexually transmitted blood-borne infections. And this will address the share risk behaviors and share high-risk populations for many of those STBBIs, including HIV and Hep C. So there's a lot of common themes here that certainly one field can enrich the other field. And we'll also recognize the social determinants of health have an important impact on the risk of transmission, on the health of people living with HIV or the different hepatitis, so B or C. And an integrated approach allows for more comprehensive health promotion and disease prevention efforts, which in turn could lead to reduced disease outcomes and improved health outcomes. So there are other opportunities that are certainly relevant to this audience. So there's one on community-based primary health care, where the goal is to support innovative approaches for improving the delivery of appropriate and high-quality community-based primary health care to Canadians. And one of the priority research areas are chronic disease and management and through this initiative. So that's certainly individuals or researchers in the field of Hep C could benefit from this approach, and access to vulnerable populations as well. You're all aware of the strategy for patient-oriented research. There's a number of the SPORE networks in youth and adolescent for primary and integrated healthcare innovations. Now there's a call for chronic disease. I have to say that it's for non-communicable chronic disease, so at this time HIV, Hep C may not be a perfect fit for that, but there will be other causes. We will see how we're going to move forward on this. So does that mean that my time is over when this drops? Or?
Your time is 22 seconds.
Okay, so well, it's very fit because this is my last slide. So, and finally, I think that for investigator-initiated research, which is still the main trust, I would say, or one of the important trusts of CIHR, and we were committed 2 years ago to increase in investigator-driven research $10 million a year for the next 5 years. So now we are in the second year of this. So it does increase the envelope by more than 10% in investigator. And you're all aware, and actually I've met people yesterday that were writing their foundation grant. So there are now two main streams. One is the foundation scheme that is and that will be about 45% of the envelope of money that is available that will go in that direction with sizable grants. So we expect that the average will be between $50K and $1.5 million. They are established investigators on the one hand that will have 7 years of funding, so it's going to be stable funding. It's going to be a consolidation of all the investigator-driven grant that those investigators have. But there's also a stream for new investigators, but in this case it will be for 5 grants. So the first pilot has happened. There were 1,400 applicants, 470 went to the second round, and now those are being evaluated as we speak. There will be a next pilot, so it's by invitation only that people will be able to apply, and afterwards in 2016 it's going to be now open to everybody. And the other one is the project scheme, so a little bit similar as what we know right now. Yeah, no problem, it's my last slide. 55% of investigator in the envelope. There will be no cap, but we expect that it's going to be a little smaller. And the first application will be in March 16. So I lied, that's my last slide. And I think that I want to say here that Jennifer Raven and Jennifer Gunning for HIV and Jennifer Raven for Hep C have been fantastic. And I would like to publicly acknowledge the marvelous work that Jennifer has done for this initiative, where really it's through her leadership that we were able to renew this, this award with the Public Health Agency of Canada, with the leadership of FAC that are present here. And I think this is great news that we can move forward on the hepatitis C arena. So thank you.
Thank you, Marc. We have time for a 15-second question.